Welcome to Samba Samba. Enjoy the video.
You start by opening the Heart app on your Apple Watch and letting it settle for a few seconds so a live heart rate appears. Make sure your band sits snugly about 1 finger width above the wrist bone. Loose fit causes artifacts. Once you see a reading, swipe down or use the crown to reveal the graph view. This is the baseline you'll use to interpret trends. Pay attention to the current BPM and the graph's timescale so you know what period you're analyzing. Now you examine the graph to learn what each element means. The horizontal axis shows the time window, and the vertical axis shows beats per minute. Look for sharp spikes that indicate brief exertion or anxiety, and sustained elevation that suggests activity or stress. Once done, zoom or scroll with the crown to inspect specific minutes and tap peaks to read exact BPM values. This helps you correlate events like workouts, medications, or rest that cause changes. Make note of patterns over hours. Finish by exporting or checking the same heart rate timeline in the iPhone Health app for longer trends and averages so you get context beyond the immediate graph. When you spot an abnormal episode, note the time, what you were doing, and any symptoms to share with a clinician if needed. If the graph shows inconsistent jumps, make sure the sensor is clean and the watch sits correctly. If problems persist, restart the watch and remeasure to confirm reliability.
Thanks for watching. Consider subscribing if we helped you.